This is Kelly Pultro. I'm doing my Module 1 video for IV piggyback meds. I'll be showing you how to set up IV fluids and IV antibiotics. I lost my voice, so I apologize if I'm not that loud. Also, if you see me keep moving my screen, it's because I haven't figured out how to get my computer screen to stay on. I'm a little bit set up down here with all my supplies, so you guys can see that, but it doesn't really quite reach everything. So here we go. So my name is Kelly. I'm going to be setting up IV fluids first, and then IV piggyback of our cephalexin for our patient, Ellen Davis. The first thing I would do is check our MAR, which is electronic, so you can't see it because I'm using my computer, but according to our medication record, we are going to be setting up normal saline, sodium chloride, 500 milligrams via the IV using gravity with a 10 drops per ml setup tubing, and then we'll also be setting up a secondary IV of the IV piggyback of the cefazolin, which is 1 gram to be given IV piggyback over 30 minutes. We're going to be doing that in 50 mLs with our secondary IV set of also 10 drops per ml tubing. So obviously we need to discuss that all the appropriate things are available to us, and that we're going to, after we review the MAR, then we're going to go to our med room or our Pyxis or our closet where our fluids are all stored. You want to make sure that you have the correct things prior to setting them up. So in this case, we have 500 mLs of sodium chloride, which is our normal saline. We're going to check to make sure that there's no particles in it. Make sure you have the right thing. You're going to check the expiration date. In this case, it doesn't expire until January of 2023, so we're good for that. I'm going to make sure that I have a regular IV setup, which I do have. Then I'm going to make sure I have my medication from the pharmacy. We're going to make sure that the expiration date is correct, which is again January 2023, so we're good there. We're going to make sure that they're not cloudy, nothing's in it, and we're going to make sure that we have our IV secondary set up for that. Once we have checked our MAR once, then we have checked again, we've checked our meds against the MAR. We're going to collect all our supplies that we're going to need. In this case, we're using our towel arm. We have hand sanitizer, clean gloves. I also have some alcohol swabs, and these are just regular things that I always have: pen, marker, tape, scissors. I usually always have that in my pocket because we're going to need to label our things. So once we've made sure that we have everything that we need, then we're going to take everything into the room. We're going to introduce ourselves to the patient. Hi, Miss Davis. My name's Kelly. How are you today? Oh, good. I'm glad you're here. You're doing well. I'm just coming in. I see that we just put in the IV. In this case, we're not flushing it because according to our instructions, it was just placed and we know that it's patent. I'm going to go over the medications with her, especially if you're giving an antibiotic. You're going to want to go over education with them, what the antibiotic's for, signs and symptoms that they can look out for, and make sure that they verbalize back to you understanding of knowing that those symptoms are, and being able to let you or the doctor know if they're having any of those symptoms. So we're going to ask her name and date of birth. We're going to check it against her wristband. Ellen Davis, date of birth September 19th, 1965. Her medical record number will be on there. Also, if she has any allergies, she may have an allergy wristband. If not, on your MAR, when you're checking your MAR, you'll be able to see on your MAR if there are any drug allergies, any food allergies, any seasonal allergies. In this case, our MAR states that she has no known drug allergies, and there's no history of her having any allergic reaction to any of the medications that we're giving today. In addition, you're also going to check to make sure in your drug book that the medication that's going to be given is not going to have a reaction to what fluids she's on. So when you look up in your drug book, you're looking up cefazolin, sorry, and we have no interactions, so that's good. So we're going to make sure that if there's anybody in the room, we ask them to step out into the hall. We're going to give her a little bit of privacy. We're going to perform hand hygiene. We're going to make sure, again, that we're going over when we're hanging it, that we're hanging the right thing. That'll be a third check. It's very important to do all of our checks. Right patient, right drug, right route, right time. All those things that we are, constantly checking as nurses. So I have my my little hooks here. So we're going to go ahead and get started. Sorry, I'll try to talk a little louder. So we're going to go ahead and open our bags here. Make sure that you put everything in the trash. Right. First thing you want to do when you open your tubing is make sure that your tubing is clamped, so that way nothing falls out all over the floor and gets everything all wet when you stick your bag. So here's our tubing. We've made sure that we are all the way set. I'm going to make sure we keep the spike and the port covered because they are sterile, and we do not want to get anything touching them because you don't want to break sterile. When you're spiking, the easiest way to do it is if your bag is upside down. Some people will do it with it hanging. I personally do it upside down. I have better control of the bag. So you pull your cap off. You also pull your spike off. And then you insert it right into the bag. Sometimes you kind of have to twist as you push to make sure that it gets in there good. You don't want anything falling out all over the place. Okay, then once you have it spiked, you're going to set it up. You're going to squeeze your chamber to get it about half full with fluids. You also need to prime your tubing so that there's no air in the tubing. The way to do that is to open your tube. You can do it very little, and it's going to allow that fluid to come all the way through. You want all of the air bubbles to come out. I usually just have a trash can with me so I can hang it over the trash bag. Make sure everything comes out. Wonderful. And then we clamp it all the way down. It's important to do aseptic technique because you don't want anything to jeopardize the sterileness of everything. Before I hook it up, I personally put on gloves after I perform the hand hygiene. That's just how I do it. When I'm touching somebody's port, I want to make sure I'm not getting it dirty in any way. So again, in this case, we know that it's patent. So you're going to take alcohol swab. You're going to clean vigorously on the port for 15 seconds. You just want to make sure that there's nothing on there, no bacteria, anything really gross, hair, you name it. You want to make sure it's clean. That time you're going to take the cap off here and you're going to insert it into the port and twist so that way it is attached to the patient. Now for our fluids, our IV, our fluids of normal saline, We were given the 500 milligrams via the IV. We're using the 10 drops per ml tubing, and we're supposed to be giving it at 125 mLs per hour, which calculates into 21 drops per minute. We're using gravity, so you're going to have to open your tubing slowly, and you're going to count for a full minute on your tubing and counting your drips at the same time as you open it. So it is pretty self-sufficient as you open. You just do it slowly. Once you get drips, 2, 3, 4, and 6, 7, 8, 9, 10, 11, 12, 13, 14, 16, 17. All right, so we're running at 21 drops per minute on our normal saline. For this, we want to make sure that we are labeling our tubing because tubing can expire. In this case, my setup in my kit did not have labels, so I wrote down today's date, expiration of date of 3 days later, so 5/8, expiration 5/11, and I initialed it. I'm going to label my tubing right below the drip chamber so that way it doesn't get wet or get gross. So we also want to make sure that we are labeling what we have in the bag so that way there's no miscommunication of any kind. In this case, we have normal saline, again, no labels, so I wrote it on a piece of tape in my Sharpie. Love my Sharpie, carry it with me everywhere as a nurse. So we have the sodium chloride, the normal saline. We're giving it 125 mLs per hour, which in turn turns into 21 drops per minute. You're going to put it on the back where there's no expiration date, no wording, because you don't want to cover anything. So that's what we're going to do for our normal saline. Then we're going to move on to our IV push setup next. At this point, once you've gotten them set up and their fluids are running normally, you want to make sure you clean up your area, make sure you throw everything out, and you want to check and make sure that the IV site is clear of any leaking, any swelling, any coolness or hot to the touch or anything like that. And then you'll want to reassess that after it's been running for a little while. So that's how you set up the IV fluids of normal saline. And I'll be back with another IV video for my IV push, piggyback of this cefazolin. Thank you.